Okay, hello, ladies and gentlemen. Over the next 15 minutes or so, I shall be presenting medical facts for living with COVID-19. In essence, I shall be looking at the information from the medical journals to answer four important practical questions. Who is most likely to get COVID? Who is more likely to become severely sick after catching COVID? How do we avoid severe COVID infections? And how should we live through this pandemic? The first study comes from the London School of Tropical Medicine and Hygiene, published in Nature Medicine in June 2020. This look at the age group effect on transmission of COVID cases in 29 districts from 6 countries. The curve of the age group distribution of COVID cases is generally bell-shaped. The peak of the bell coming at middle age, and in some cases at the later age group, and in others having a double peak effect. In essence, meaning that the patients who fall sick from COVID tend to be adults. The children tend to be spared from COVID. The authors looked at the patients under 20 years of age and find that they are only half as likely to catch COVID compared to older ones. In the young patient below 20, only about 20% of them actually become sick, feeling the symptoms of COVID. However, for the older COVID patient above 70 years, almost 70% of them become sick with symptoms from the disease. In other words, the young are less likely to catch COVID and are less likely to become sick with symptoms after catching COVID. Next report is published on the 22nd of September in PLOS Medicine, and it comes from Bern, Switzerland. It looked at the occurrence and transmission of COVID amongst the asymptomatic cases. The authors reviewed 94 studies, and they find that 20% of patients reported in these studies actually feel no sickness, having no symptoms throughout the course of the disease. Looking at 7 studies that are well done with good follow-up, about 21% of the patients were reported to have no sickness or no symptoms throughout the course of their disease. Furthermore, contacts of COVID patients with no symptoms are less likely to get infected, having the risk only 35% of that from the symptomatic COVID patients. In other words, 20 to 30% of COVID positive patients go through the disease without feeling sick. And COVID patients who are not sick, who have no symptoms, are less likely to spread the condition. Next comes a recent paper published in December this year in the Lancet Regional, and it looks at the relationship of patient characteristic with their outcomes from COVID in Korea. Almost 8,000 patients were reviewed, and at diagnosis, almost 95% of them report mild sickness or no sickness at all. 4.8% are severe and 0.6% critical. Severe patients need oxygen either through the nose or by mouth, while for the critical patients, they either need high flow oxygen or they need ventilation. Now, for the patient with no sickness or only mild sickness, only 1.1% died. The vast majority will recover. For the severely sick patient, almost 30% will die, and for the critically sick, about 60% will die. When you look at the age characteristic of the patients, the older the patients are, the more likely they are to be severely sick or critically sick, compared to those under 50. Those above 70, for example, are over 17% more likely to be severe and over 28 times more likely to be critical. For males, they are over 68% higher risk of having severe disease and over 215% higher risk of having critical disease or death. The presence of other disease conditions like hypertension, diabetes, kidney disease, lung disease, malignancy, and dementia will also increase the risk of getting severe disease or critical illness. In other words, the age of the patient, sex of the patient, and the presence of other diseases will all significantly affect the outcome of patients with COVID. A report in November in the Annals of Internal Medicine looks at patients from New York City. It looks at the relationship of obesity with the risk of needing ventilation or death. And in 2,500 patients or so, they find that the more obese the patient, the higher the risk of needing intubation, ventilation, or death. The chart goes up. And the highest risk of patients for ventilation or death actually comes with the most obese patient. Next is a study in clinical infectious disease in October. And here, the doctors from Wuhan have drawn up a predictive model to estimate the risk of death within hospital using the age of the patient, the presence of hypertension, and the presence of heart disease. Using these three factors, they are able to predict the chances of dying in hospital to a very high degree. The negative predictive value is over 99%, meaning that this chart is very accurate in predicting which patients will not die. If you have a low point score, then the risk of dying in hospital is very low. And using these simple features, the age of the patient, presence of hypertension or heart disease, they are able to actually predict the death risk of the patient. This particular diagram shows how an infectious disease spreads and presents itself in the patient. There's a period of incubation for the infection where the patient will feel well, then the patient feels the disease, become clinically sick before recovering. In general, the period where the disease can spread involves a bit of the incubation period and almost all the clinical disease where the patient falls sick and for a short time afterwards. In the case of COVID, however, it is complicated because many patients do not feel ill throughout the course of their sickness, and sometimes, even after the disappearance of the disease, they are still not well, a situation that we now call the long COVID syndrome. Therefore, the presentation, the cause, and the outcome of the COVID patient is variable and unpredictable. They feel no sickness at all, that is, they are asymptomatic in 20 to 30% of the cases. It is mild in about 70% and severe in 5%. We know that outcome tends to be worse in the elderly patient and the obese, because when you are older and when you are obese, you tend to develop hypertension and diabetes. And the presence of hypertension and diabetes leads to heart, kidney, lung, and neurological disease, as well as presence of malignancy. Therefore, ladies and gentlemen, to prevent severe COVID, we must choose not to be obese. We must try to be functionally young. Whatever the age, we must try to maintain our health to be physiologically and functionally young. We must prevent damage and complications arising from the chronic lifestyle diseases of hypertension, diabetes, and high cholesterol levels. Remembering, of course, that obesity, damage from hypertension and diabetes can all be reversed or prevented. COVID-19 is only transmitted from interaction with humans, from contact with other humans. So you must try to avoid being a close contact. A close contact is defined by the Center of Disease Control of the United States as someone who has been within 6 feet of the COVID patient, who has spent a total of 15 minutes or more over a 24-hour period with the patient, beginning from 2 days before illness or 2 days before the development of a positive test. Therefore, you can only catch COVID if you are a close contact as defined in these three circumstances. Walking past a patient, short contact with the patient is not considered having had a close contact and should therefore not be susceptible to developing the disease. However, it is important to consider the actual proximity to the patient. The closer you are, the higher the risk of developing the disease. The longer the time you spend with the patient, the more likely you are to develop the disease. Whether the infected has symptoms or feels sick is important. The patient feeling unwell actually is shedding more virus and therefore more likely to transmit the disease. It is also important to find out whether during the interaction, respiratory aerosols are being generated, whether the patient is coughing, singing, or shouting, transmitting viruses onto others. And the environment that the contact occurs. Is it crowded? Is ventilation good? Is it indoors and outdoors? All these will affect the likelihood of catching COVID. This next report comes from the British Medical Journal in September, and it looks at the ability of fabric face mask materials to filter particles of a person who is coughing. The masks that medical people use are either the N95 mask or the surgical mask, and these generally have about a 50% filtration capacity. Using vacuum bags, that is the bags in the vacuum cleaner, actually make very good filtering masks. Unfortunately, vacuum bags are not designed to be used as masks and to be washed, and if you do so, they tend to come apart. Most commercial masks are made from the common fabric materials and are not as good as the medical mask in filtering out particles. However, if the materials are layered together, that means the masks are made from one type of material, they actually have very good filtering capacity, sometimes even better than the medical ones. So, ladies and gentlemen, not all masks or materials have the same filtering capacity, and face masks made from layers of material, layered fabric materials, are actually very good at filtering particles. We know that to prevent severe COVID, we must prevent cardiovascular disease. And to prevent cardiovascular disease, we should increase physical activity. This is a study of almost 500,000 patients, and it shows that the higher your physical activity, the lower your risk of major cardiovascular events, major coronary events, ischemic stroke, intracerebral hemorrhage, and lower cardiovascular death. The horizontal level shows physical activity, and the more physical activity you do, the lower your risk of all these adverse events compared to those who do not exercise. This holds true whether the activity is done during work, that is occupational physical activity, or whether it is done in a non-occupational way as exercise. So it doesn't matter whether you have physical activity at work or outside of work, it will be good for you in reducing cardiovascular disease. On the 25th of November this year, in the midst of the COVID epidemic, the World Health Organization actually issued its guidelines on physical activity, emphasizing that physical activity is very important, especially in this era of COVID and mobility restrictions where people tend to be confined to their homes. They recommend that in a week, adults should do up to 300 minutes of moderate activity or 150 minutes of vigorous activity. Moderate activity being defined as activity to the level of 5 or 6 out of 10, and vigorous physical activity a level of 7 or 8 out of 10. In a week, adults should do muscle strengthening exercises on 2 or more days. And for the older adults above 65, they should do activity to emphasize balance and strength on 3 or more days. This is to enhance functional ability and to prevent them from falling. Exercises like Tai Chi and yoga are especially good for balance and preventing falls in the older age group. This report in December in JAMA Psychiatry shows the relationship of certain death cases or cardiac arrest coming to the emergency room in the United States. And they find that the number of cases of cardiac arrest due to drug overdose is almost 50% higher this year compared to previous years. Number of drug overdose certain deaths are much higher than in previous years. And this increase in the cases of drug overdose certain deaths appear to be related to the restriction of mobility imposed on the population. So when mobility is restricted to prevent the spread of COVID, certain deaths due to drug overdose actually increases. Many reasons why suicide and drug overdose might increase in this COVID era related to the uncertainty that COVID induces, social isolation that comes about, or the economic problems it causes. Now, in Japan, in the month of October, there were 2,153 deaths from suicide. From the beginning of the COVID pandemic to October, there have been 2,087 deaths from COVID. Therefore, number of suicide deaths in Japan in the month of October alone exceeded the total coronavirus death from the beginning of the pandemic. Male suicides have increased 22% in Japan, while female suicides have increased 83%, meaning that if you find it very difficult staying with the wife, it is much more difficult for her. There are still many unanswered questions about COVID. Do all infected patients develop antibody and then immunity? A patient after COVID can be positive for a long time or positive again. Is this just a laboratory condition, or do they really become infected again with COVID? Are there a lot of undetected COVID positive but asymptomatic well patients living in the community? Has COVID-19 actually been around and undetected for some time? Because they have found antibodies to COVID in the blood of Italian patients in September 2019. And on December the 3rd, in America, they've actually isolated a genome of the COVID virus identical to the one that Wuhan had. So has it actually been around undetected for some time? What is worse is to ask whether there are many others unknown, undetected viruses circulating amongst us. And if that's the case, COVID will not be the last of the pandemic affecting society. The vaccine against influenza has to be changed and taken yearly with a reported efficiency of 40 to 60%. What about the COVID vaccines all ready to be delivered? Now, the Pfizer vaccine is the one that has been approved in UK, US, Canada, and some Middle Eastern countries. And a report on the vaccine was published on the 10th of December in the New England Journal of Medicine. From 170 COVID cases, it is found to be 95% effective after the second dose, 52% effective after the first dose. However, there is a problem of allergy. Now, before a drug can be approved, the FDA advises meet and vote on it. And the vote for the Pfizer vaccine is 17-4-1. There are 4 against approving it, even for emergency use, and 1 abstention. Normally, if a drug is clearly good, the vote would have no dissension, no votes against, no abstention. And the FDA advisors asked the manufacturers to look at the problem of anaphylaxis or severe allergy after 2 nurses in the UK had this anaphylaxis reaction to their vaccination. The problem with the Pfizer study is that there has been no Asian site involved in the study. It is a study mainly in the United States, Argentina, Brazil, South Africa, Germany, and Turkey, with no participation of Asian centers. It is still now a very short trial, a median time of only 2 months, and the infection rate is also very low, 0.75% in the group that did not got the dummy vaccine that was not actually vaccinated, and in the vaccinated group, an infection rate of 0.04%. Figures that actually show this trial is in its very early stages. We do not know the effect of the vaccine on the asymptomatic case, which make up 20 to 30% of all COVID cases. And therefore, the ability of the vaccine to actually stop transmission is unknown. The design of the trial was that only people with COVID symptoms will be tested for COVID. So the trial will not be able to pick up whether it is helpful in preventing the asymptomatic COVID infection. There are a few other vaccines around. The one by Sinopharm has been approved in the United Arab Emirates, which announced a 86% effectiveness for the vaccine. No details have been published. Indonesia has announced another vaccine, the Sinovac vaccine, has a 97% effectiveness with no details. The Russians have announced a 92% effectiveness based on the first 20 cases of the Sputnik 5 vaccine. Oxford AstraZeneca on the 8th of December has published in the Lancet their results from 131 COVID cases conducted in the UK and Brazil. However, the trial actually involved two centers in UK, one in Brazil and one in South Africa. They reported from the UK and Brazilian centers, but not from the South African one. And the unfortunate point is that each center has a slightly different method of conducting the trial. The result they came up with was that the trial at lower dose, the vaccine given lower dose is 90% effective, but the vaccine at the higher dose is only 62% effective. And these are very strange figures indeed, where a person getting the higher dose has less protection than people getting lower doses. So the answer is obviously, of course, longer time and more data is necessary. Moderna has another vaccine. It has given a press conference about 95 cases of COVID patients, saying that it is 94.5% effective with no other details. During the press conference, however, they have mentioned side effects from the vaccine, fatigue almost at 10%, muscle pain at about 9%, joint pain in 5%, and headache almost in 5%. All fairly significant factors of significant proportion of side effects for patients undergoing vaccination. In this COVID era, ladies and gentlemen, we can and we must turn this problem, this adversity, to our advantage. We must change from thinking about protecting our future, our income, and our family to protecting our present, our body and mind. With or without the vaccines, we must wear the right mask in the right manner. We must practice social distancing. We must reduce mental anxiety, which can be very, very bad for health. We must increase physical activity to reduce cardiovascular disease. We must avoid obesity and therefore controlling hypertension and diabetes. We must try to be physiologically, functionally young, and we must treat lifestyle diseases to prevent its complications. And with that, I thank you very much.